At Jacaranda, one of the challenges we had before at least we integrated our current solutions was responding to moms. And there's a lot of questions we're getting. I mean, questions to do with nutrition, just general maternal health questions. As the questions pile up or just coming in speed because of engagement, we cannot answer every question using a human being. So we came up with a solution, an AI model, to kind of help offload some of the generic questions. For the urgent questions, we still definitely want to have a deeper look into them. We are running all of this on SMS, at least with our AI solutions, to make sure that it reaches everyone. Kenya, I wouldn't rank it as highly connected. You know, there are certain parts of the country we have moms who don't have access to reliable internet connections, but SMS is there. So kind of pushing towards scalable solutions, simple to deploy and simple for people to use. The main challenge in general, Swahili is a low-resource language. The model does understand Swahili, but it doesn't understand the context of what we are trying to look at, and the context are big: maternal health. One of the things, at least, to try and solve this is we are looking at collecting data and then improving models. So this is why I was speaking about fine-tuning. You pick something which kind of works, but in a very generic sense, and then you bring in your own skills and you try and make it work really good. Accuracy is at the topmost of everything. So at the end of the day, you want to understand what someone's saying. At Jacaranda, we try to integrate AI where we think it's needed. Currently, our setup is text-based. So you send a text, and then you get a response in a text. But specifically with Swahili, which is the common language for most of our moms, the speech is going to be a bit easier in terms of literacy, especially for moms in settings that are not that highly literate. What we're looking at is building methods to allow for people to simply speak. So speak in their most natural format, natural way. So kind of have a solution which seems a bit more natural, to the same way a mom would walk into a clinic and talk to a nurse or talk to a doctor about ABCD. So we could talk to a device and get some information.